Every year, millions of seniors faithfully attend their routine checkups, confident they are taking the best possible care of their health. But what if I told you that some of these very tests, the ones designed to protect you, could silently increase your risk of a stroke, almost overnight? It sounds hard to believe, doesn't it? You trust your doctor. You follow every recommendation. Yet buried within the protocols of modern medicine are hidden risks, dangers that are seldom mentioned in the news, on the brochures in your clinic, or sometimes even by your physician. Imagine walking out of your annual checkup feeling reassured, only to experience dizziness, blurred vision, or worse, just days later. You're left shaken, wondering, what just happened? Here is the truth. Certain diagnostic tests, particularly when performed too frequently or on individuals with specific health conditions, can quietly trigger sudden spikes in blood pressure, disrupt the delicate flow of blood, and set off a chain reaction that may culminate in a stroke. But please, don't worry. This message isn't here to scare you. It's here to empower you, so you can ask better questions and protect yourself and the people you love. Because after the age of 60, healthcare isn't just about catching problems early. It's about avoiding the ones we might unintentionally create. In the next few minutes, we will uncover the 5 most common medical tests that can carry hidden stroke risks for seniors. More importantly, you'll learn exactly how to safeguard yourself before your next appointment. If you are over 60, let us know by dropping a 1 in the comments. If you're not, a 0 will do. And be sure to subscribe to Health 365, where we uncover the health truths that often go unspoken. Now, let's discuss the first test you should think twice about. If you've ever had a CT scan with contrast, you might recall a distinct warm flush spreading through your body. That's the contrast dye at work, helping your doctor visualize your blood vessels, organs, and tissues with greater clarity. It sounds beneficial, and it often is. But here's the part many seniors are never told. That small injection can do more than just enhance an image. It can place quiet, sudden stress on your cardiovascular system, especially if you're over 60 and already managing high blood pressure, heart problems, or kidney issues. In some individuals, the contrast dye triggers what's known as a vasovagal reaction, a sudden drop in both heart rate and blood pressure. This can lead to dizziness, nausea, fainting, or even a brief loss of consciousness. In other cases, however, the opposite occurs. Blood pressure can spike rapidly, causing fragile blood vessels to tighten or spasm. When that happens, the risk of a stroke or a cardiac event silently creeps in. A study in the Journal of Vascular and Interventional Radiology found that older adults who underwent contrast-enhanced CT scans had a significantly higher rate of vascular complications within 72 hours. The risk was most pronounced in those with a history of hypertension, cardiovascular disease, or impaired kidney function. In short, the more vulnerable your system, the more dangerous that contrast dye could become. Let me share a real case. An 81-year-old man went in for a routine abdominal CT scan after some minor digestive discomfort. His scan came back normal, and he was sent home feeling fine. But 2 days later, he suffered a minor stroke. The likely culprit. The contrast injection may have temporarily spiked his blood pressure, causing a clot to form and block blood flow to a part of his brain. This doesn't mean CT scans with contrast are inherently bad. Far from it. They are life-saving tools that can detect cancers, blood clots, and aneurysms. The key, however, is that these scans should be used judiciously, not ordered as a just-in-case part of a routine checkup. So, what can you do to protect yourself? Before agreeing to a CT scan with contrast, ask your doctor, Is this scan absolutely essential, or is there a safer alternative for someone with my age and health profile? Share your complete medical history, especially any issues with high blood pressure, kidney disease, heart conditions, or previous reactions to dyes or medications. And always ask, can we perform this scan without contrast? Sometimes a non-contrast CT or an ultrasound can provide sufficient detail without the added risk. Coming up next, a common screening many seniors undergo, even when feeling perfectly fine, that may not be as harmless as it seems. Let's turn to the stress test, often called an exercise stress test. On the surface, it sounds like a proactive step. You're hooked up to a heart monitor, you walk on a treadmill, and a specialist observes how your heart performs under pressure. But if you're over 60, especially with existing high blood pressure or heart conditions, this seemingly simple test can carry significant risk. Here's why. During the test, you are asked to walk, and then perhaps jog, on a treadmill as its speed and incline increase. As you do, your heart rate climbs, your blood pressure rises, and your cardiovascular system is placed under intense, sudden strain. For a healthy 30-year-old, this is usually manageable. But for a senior, particularly one with pre-existing vulnerabilities, it can be like revving a classic car's engine into the red, potentially triggering serious complications. Some of the risks include dangerous spikes in blood pressure, sudden arrhythmias or irregular heartbeats, and in rare but real cases, small tears in fragile blood vessels, particularly those in the brain. A 2020 study in the American Journal of Cardiology examined over 1,300 patients above the age of 65 who underwent treadmill stress tests. The findings were sobering. Nearly 7% experienced adverse events during or shortly after the test, including severe blood pressure surges and abnormal heart rhythms. The group most affected? Those who already had known vascular issues. This isn't just a theoretical risk. One of our subscribers, Margaret from Ohio, shared her story. At 74, she has managed high blood pressure for years. Her doctor suggested a stress test as a routine check-in. Halfway through the treadmill portion, she began to feel dizzy and experienced a tightness in her chest. The test was stopped immediately, but by the next day, she had suffered a minor stroke. Her doctors believe the sudden surge in her blood pressure during the test ruptured a tiny, fragile vessel in her brain. To be clear, the test didn't directly cause the underlying condition, but it introduced a level of stress that an already vulnerable system couldn't handle. And that's what tipped the scales. So, what is the takeaway? Talk openly with your doctor. Ask, is there a safer way to evaluate my heart's health? In many cases, a nuclear stress test, which uses medication to simulate exercise, or a simple resting echocardiogram, may be safer and equally effective options for seniors. And if you aren't currently experiencing symptoms like chest pain, shortness of breath, or unusual fatigue, question whether the test is truly necessary right now, or if it can be postponed. Next, we'll explore another routine procedure that seems harmless, but could come with hidden risks if you're not careful. Let's now discuss a procedure that has become incredibly routine, especially after 60, the endoscopy. Whether it's to examine your esophagus, stomach, or colon, doctors often recommend it as a precautionary measure. And sometimes, that's absolutely the right call. But here is the risk that's rarely discussed. If the procedure isn't strictly necessary, and particularly if it involves sedation, it might introduce more harm than good. To start, most people over 60 are on at least one type of medication. Blood thinners like warfarin, aspirin, or Plavix are extremely common. When you are sedated for an endoscopy, your blood pressure and circulation naturally fluctuate. Combine these physiological changes with medications that alter your blood's ability to clot, and you create a heightened risk for internal bleeding, or even more concerning, circulatory problems in the brain that can trigger a silent stroke. In 2021, a large-scale review published in the journal Gastrointestinal Endoscopy found that among patients over 65 who underwent sedated endoscopy procedures, there was a notable increase in transient ischemic attacks, also known as TIAs or mini-strokes, within the following 72 hours. These weren't catastrophic events, but they were critical warning signs that blood flow to the brain had been compromised. One case that has always stuck with me involved a 76-year-old woman who had a routine colonoscopy with sedation. She had no symptoms beforehand. 2 days later, she began slurring her speech and experienced a loss of coordination. A visit to the emergency room confirmed she had suffered a mild stroke. Her medical team believed the drop in blood pressure during sedation, combined with her daily aspirin regimen, may have created the perfect conditions for a blood clot to travel. Even if the procedure itself is low risk, the combination of sedation, age, and medication can create a perfect storm. This is not to say you should avoid all endoscopies. It means you should not agree to one unless your doctor can clearly articulate why it is necessary for you right now. If it's being recommended simply because it's been a few years, ask if there are safer ways to monitor your condition, especially if you have no symptoms. Always remind your doctor of every medication you are taking. Ask them directly, "Will I need to stop my blood thinner for this? What are the risks of sedation for someone with my health profile?" And if you are uncomfortable with full sedation, ask if the procedure can be performed without it, or with lighter alternative options. Next, we're going to address another test that often flies under the radar, one that involves an organ many of us never think about in this context: the kidneys. MRIs are powerful diagnostic tools. They allow doctors to see deep inside your body, spot early signs of trouble, and in many cases, avoid the need for invasive surgery. But when a contrast dye is introduced to obtain clearer images, caution is required, especially for older adults, and most critically, for those with even mild kidney problems. The contrast agent used in MRIs often contains a heavy metal called gadolinium. In a healthy person, this substance is not meant to stay in the body. It's designed to be filtered out and flushed away by the kidneys. But here's the catch. After the age of 60, kidney function naturally begins to decline. And if you have undiagnosed chronic kidney disease, or even slightly reduced function, your body may struggle to eliminate the gadolinium effectively. Over time, small amounts can linger in the body, and this retention can be dangerous. It has been linked to a rare but serious condition called nephrogenic systemic fibrosis, or NSF, which causes the hardening and thickening of the skin and connective tissues. In the worst cases, it can impair movement, breathing, and even lead to organ complications. But here is the part that often goes unmentioned. Retained gadolinium has also been found in brain tissue. Some researchers now believe it may be linked to subtle neurological symptoms like confusion, dizziness, and disorientation, particularly in people who are already at risk for circulatory problems. A study published in the journal Radiology in 2019 tracked over 2,000 patients over 65 who received contrast-enhanced MRIs. Within a week of the procedure, About 5% reported experiencing stroke-like symptoms, headaches, blurred vision, and balance problems. While these were not full-blown strokes, they were significant red flags. The majority of these patients also had underlying kidney issues, whether they had been diagnosed or not. Harold, a 79-year-old veteran from Arizona, had an MRI after struggling with persistent back pain. His doctor ordered it with contrast to be thorough. Harold had no idea his kidney function was compromised. 2 days after the scan, he felt lightheaded, weak, and mentally foggy, symptoms that lingered for nearly a week. It wasn't until his primary care doctor ran new lab work that they discovered he had stage 3 kidney disease. "No one warned me," he told us. Had I known, I would have asked more questions. So here's what you can do. If your doctor recommends an MRI with contrast, ask, "Can we get the information we need without the contrast?" Often, the answer is yes. If contrast is truly necessary, request a kidney function test beforehand. It's a simple blood test known as a GFR, and it can provide you and your doctor with invaluable peace of mind. And always inform them if you've ever had unusual reactions to imaging tests in the past. Remember, the MRI itself isn't the problem. It's the added chemical that your body may not be equipped to handle. With the right precautions, you can get the answers you need without putting your brain or kidneys at risk. Next, let's turn our attention to a test that seems harmless, even proactive, but may be steering older adults toward risky surgeries they never actually needed. The routine carotid artery ultrasound. It's non-invasive, takes only a few minutes, and involves no needles, dyes, or loud, intimidating machines. It sounds like the perfect preventive test, doesn't it? But here's what most people over 60 don't realize. If you don't have any symptoms, and this scan is ordered simply as a screening, it could start you down a path to a major surgery you never needed in the first place. The carotid arteries are the primary vessels delivering blood to your brain. Over a lifetime, it's normal for them to develop some plaque, small buildups of cholesterol or calcium. This is a natural part of aging, but not every piece of plaque requires surgical removal. In fact, in many cases, it is far safer to monitor it with medication and lifestyle changes than to operate. Here's where things can go wrong. Let's say you have this screening, and it reveals some narrowing in an artery, perhaps 50 or even 60%. That number sounds frightening. Your doctor then refers you to a vascular surgeon, and suddenly you are being advised to consider a procedure like a carotid endarterectomy or a stent. However, if you have had no symptoms, no dizziness, no vision changes, no weakness, these invasive procedures may offer very little benefit, and they come with very real risks. A landmark study published in the New England Journal of Medicine followed over 3,000 seniors who had moderate carotid narrowing but no symptoms. The researchers found that for many of these patients, surgery did not reduce the risk of stroke any more significantly than medication and healthy lifestyle changes alone. More troublingly, a small but significant percentage of patients who underwent the surgery actually suffered strokes as a direct complication of the procedure itself, either during the operation or in the recovery period. One story that truly hits home is that of Helen, an 82-year-old from Pennsylvania. During a checkup where she felt perfectly fine, her doctor ordered a carotid ultrasound just to be thorough. It showed a 65% narrowing. Within weeks, she was scheduled for surgery. Tragically, during the procedure, she suffered a small stroke. She survived, but now lives with partial weakness on her right side. She later told us, "I wish I'd known that doing nothing might have been the safer choice." So, what should you do? If your doctor suggests a carotid ultrasound and you have no symptoms, ask pointed questions. What exactly are we looking for? And what is the plan if we find it? Ensure you understand whether the scan is likely to change your treatment or simply introduce anxiety. If you are already managing your blood pressure and cholesterol and leading a healthy life, additional tests may not alter your path. And if a scan has already shown some narrowing, don't panic. Ask about monitoring it with repeat scans instead of rushing to surgery. And always get a second opinion before agreeing to any vascular procedure. Let's wrap this up with a final thought. A gentle reminder that your health is ultimately in your hands. Here is the bottom line. Not every test is dangerous, but not every test is necessary. Especially after 60, our bodies respond to medical interventions in unique ways. What seems routine, a contrast dye, a sedative, a screening scan, can create ripple effects we don't always anticipate. A simple injection might cause a pressure spike. A scan might trigger a reaction. Even a harmless checkup can carry risk if your system is already vulnerable. That is why it is so critically important to pause, to ask questions, and to ensure every test is tailored to your individual health needs, not just a standard protocol. You have every right to speak up, to ask, is this truly essential? And to say, can we explore a safer alternative? Informed decisions lead to better outcomes and a profound sense of peace. Your health story matters. Your voice matters. And we believe that every choice you make should be guided by knowledge, not by fear or by habit. If you have ever felt unwell after a medical test, or have watched a loved one go through something unexpected, let us know with a 1 in the comments. If not, post a 0. Let's share our experiences, connect, and learn from one another. And if this has helped you feel a little more aware, more in control, or simply more curious, please subscribe to Health 365. We are here to uncover the truth, to ask the hard questions, and to always put your well-being first.